In today's video, you are going to learn how to increase your walking speed. We know that decreased walking speeds is correlated with increased risk of falls and increased disability as we age. So what you'll learn today is what a normal walking speed is and what I think are some of the key elements that someone should focus on in their home exercise program if your goal is to increase your walking speed. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injury, with the end goal of empowering you with as many tools as possible to take ownership of your rehab and your health, to live an overall more active, more mobile, pain-free, happier, healthier life. So first, let's just talk about what is normal walking speed. They do measure this, and we measure it. Some of you guys probably have done this in physical therapy. The most commonly used way to measure walking speed is to do a 10-meter walk test. So if any of you know, someone got you in a hall, they had a stopwatch, and they said, go, and they told you to walk at a comfortable speed, and then you probably did it a second time and they asked you to walk at a little bit of a faster speed. So they were testing your gait speed. So let's go over what some of the norms are so you kind of have an idea of whether you're kind of in the normal range for your age or whether or not this is something you even need to work on. So 0.4 meters per second is what we consider necessary to be a household ambulator. So that means to be able to walk around your house safely. 0.8 meters per second is what we would consider a community mobile ambulator. So that means that you could walk across the street in the amount of time that like a crosswalk light would allow you to, or get from through a parking lot, get from your car into a store. They've probably done some tests on this, and that's what they've come up with, is that 0.8 meters per second is adequate for being able to get around in the community. But adequate isn't necessarily normal. So there are some norms for walking speed. So if you're under the age of 50, and I'm kind of grouping a lot of age groups together here. So under the age of 50, on average, you want to be able to walk 1.3 meters per second. So the way you calculate meters per second is you take the distance, which is 10 meters, and you divide it by the number of seconds it takes you to walk that distance. So if you walked 10 meters in 10 seconds, that would be 1 meter per second. So 1.3 meters per second for those of you under 50. I'm sorry, 1.4 meters per second for those of you under 50. Those of you 60 to 80, and again, I'm grouping a couple of age groups together, about 1.3 meters per second. And then 80 and above, you want to be able to walk at least 0.9 meters per second to 1 meter per second to be considered normal for your age. So now, if you fall below those norms, how do you increase walking speed? It seems very easy. It seems like you would just, well, you just got to walk faster. And yes, that is true. But what I found, this is just my personal experience, is that when someone is told or instructed to walk faster, they have a tendency to just take bigger steps. And if you're someone that has hemiparesis, meaning you have weakness on one side of your body, people take this great big giant step with your weaker leg and then take this little tiny itty bitty step with your stronger leg is very common. I'm not going to say that's the only kind of compensation that people do, but that probably is the most common. So it's great big step, little step. Okay? So taking bigger steps is one way to increase your walking speed, but something I like to do, probably another thing you can modify outside of taking bigger steps, is increasing cadence. So cadence is the number of steps that someone takes in a minute. Normal cadence is between 80 and 120 steps per minute. And that is what we're going to go over in today's video, is how are some ways that you can increase your cadence. Now, what are some reasons why someone might have a decreased cadence? Well, there's a few things that I can think of. For some of you, you don't feel confident in one leg, and so you kind of almost have to like feel that leg on the ground for a minute before you take your other leg and step it forward. That's probably the most common thing that I see with people that have a decreased cadence, meaning they fall below that 80 steps per minute. And the way you might know that if that's the reason why you might be having a decreased cadence is if you walked in front of a mirror, had someone videotape you, probably you're leaned to one side, and maybe you are someone that always kind of has that, your weaker leg just slightly out in front of you. That does impact your cadence. So then when you go to try and take bigger steps, because sometimes therapists will tell you to take bigger steps, you have to stop for a second and pause before you can step that other foot forward, and that decreases the number of steps that you can take in a minute. And then the other thing that potentially could be the case is that you can't bend your leg. So we've talked a lot about that. We're not going over how to bend your knee in this video, but what I want to point out is that if it's that you can't stand on that leg, I have a ton of videos on how to increase your single leg standing. The other one is if you can't bend your leg, then it does take a little bit longer to kind of lift your hip up and swing that leg around the side, and that could potentially decrease your cadence as well. So in that case, you would want to work on any videos that I talk about a stiff leg, or any video where I happen to mention in the title that we're going to work on swing. Those would be the things that you would want to incorporate. So if, again, to reiterate, if you're not confident standing on your leg, or you don't know if that's the problem, I would say probably the best test would be, can you stand on your weak leg, or the leg that you might not be confident on, for 3 seconds? If you can't stand on it for at least 3 seconds, then potentially that is what is contributing to your decreased cadence. So if you can't stand on that leg for 3 seconds, that would be the thing that I would spend some time working on, is single leg standing. And then the last thing I can think of is that it's just habit. You're just used to walking slower, either because people in the hospital told you to walk slower or be careful, or you feel fearful, or you just want to be extra cautious, or maybe you've fallen. So those are the things that I could think of outside of having like a mechanical problem that's contributing to your cadence. And that's what we're going to work on today, is how to take like an immediate step. So as soon as your foot hits the ground, picking that other foot up. So think about it, when we're walking, as we're loading one leg, we're already unloading the other leg. So keep that in mind, that as you're loading one leg, you're already unloading that other leg. That's automatic. That's not something we think about. So maybe you just have gotten out of that rhythm of that automaticity of walking. And so what we're going to focus a lot on, and what you can focus on when you are walking, is to get onto that leg and take a quick step. And we're going to go through a variety of ways in which you can do that. Now, there's one other thing that I do want to mention, and that is a metronome. So metronomes, I think, are used a lot with music. They can be used, there's an app for that, and you can set the metronome to a certain number of beats per minute, and then your goal would just be to kind of step to the beat of that music. And then one other thing I do want to bring up that I meant to mention earlier and I didn't bring up, in most cases, if you have Parkinson's disease, this probably isn't something you necessarily need to work on. And if you were going to work on cadence, I would definitely work on it with a physical therapist first. Cadence might be an issue with your walking, but there's a whole lot of reasons why with Parkinson's disease you don't want to increase your cadence. If you are someone that has Parkinson's, and if you've ever gotten into like what they call that festination, where you're just taking a lot of quick steps and you're kind of forward falling, those types of issues would need to be like ruled out before you kind of addressed like a cadence issue. So just some things to keep in mind. A metronome is great. I will put a link in the description below for a free app that you can use, that you can just have on your phone. If you're ready to start implementing these exercises that we're going to go over today into your daily routine and take your rehab program to the next level, you can download our free handout that has photos and descriptions of all the exercises we'll be going over today in this video, to make it that much easier for you to implement these exercises in your routine without having to keep coming back to this video. So get your free gift by clicking the link in the description below. And now let's dive into the exercise. So the first exercise we're going to do is just weight shifting. So remember what I said, that we're kind of unloading one leg as soon as we're loading the other leg? Well, you don't actually have to be taking a step to start working on that. So the first one you're just going to do is just weight shift with that unloading at the same time, because that's kind of what we do when we're walking, but instead of going forward, We're just going to kind of work on it in place. So you're unloading and weight shifting at the same time. That's absolutely essential to be able to pick that foot up continuously. So as soon as you load one leg, immediately pick the other foot up and step. And then once you feel like you're pretty good at that, then you're just going to march. I know, seems pretty easy, but we got to get the foundation down first. And this is probably the easiest way to work on that weight shift and unloading. So those two activities would be the foundation. One of those, either just heel lifts or knee lifts. All right, that would be the first one. And then the second one is working on that anterior weight shift with that unloading. So you're going to shift and lift, shift and lift, shift and lift. You're getting into the habit of loading one leg and unloading the other leg at the same time. Shift and lift, shift and lift. So you're shifting forward, loading and unloading at the same time. All right, so for this next one, we are going to work on a stand with an immediate step. So now we're getting a little bit more challenging. So you're going to stand and step. Okay? And for those of you, I'm going to do this on both legs, and I recommend you do it on both legs as well. So we're going to stand and step, down, stand and step, down. Now, use your hands if you need to for safety, but the goal would be that eventually you could do this without using your hands. It's always good to practice getting up from a chair without using your hands. If you're new to practicing that, make sure your chair is pushed up against a wall so that you don't push it out from under you. But the goal is that you could do this again without using your hands. So stand and step, step back and down. Again, we're trying to get that immediate step. Stand and step, and back down. All right, now do not move on until you have mastered those exercises. And if you are someone that can't walk without an assistive device, then don't move on. So now we're going to get a little bit more challenging to really build your confidence with taking that automatic step, okay, in any situation. But because we're going to get a little bit more advanced, it's really not safe for any of you who are still require an assistive device to walk, or if you've had a fall in the last year. So now we're going to stand and step over the block, and then step back and back down. So you're going to stand, step over, step back, and back down. And again, you would want to do this on both legs. So stand, step over, step back, and back down. Stand, step over, step back, and back down. All right, now we're going to add a step. So you're actually going to load the leg, step over, and lift the back foot. Put it back on the step, step over and lift, down, step over, lift, loading and unloading. But adding some variables that require a little bit more strength when you do it. Loading and unloading. Okay, and then you're going to switch. And same thing. Step, over, unload, 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 and unload. All right, now we're going to add a little bit of a balance pad. So this is going to make it a little bit more challenging to stand on that leg. So if you're someone that you do lack confidence standing on that leg, then go with, this might be a variation that you'll want to work on. So you're going to stand on the leg, cross over, stand back, and step back. Stand, cross over, stand. So the reason I think this is valuable, and I did this recently with a patient, is it did challenge the balancing a little bit more on this leg, so that when we went back to just walking on a firm surface, it did seem like it was a little bit easier. So if you challenge yourself a little bit more as far as what you're demanding the body to do, then hopefully just like a solid surface won't it'll be a little bit easier and it can be a little bit more automatic. So over and back, over and back. And I would do this on both legs. Now, the reason I like crossing across midline is it really does kind of test your balance a little bit more. So, and for a lot of you, not all of you, but a lot of you that have hemiparesis, which is weakness on one side of the body, I'm probably going to say that a lot more in videos because I've been using that word lately, and some people don't know what that word means because not everyone that watches these videos has had a stroke. So when I say hemiparesis, that just means weakness on one side of your body. But in that case, there is a tendency to not get your weight shifted over that leg adequately. And if your leg is not shifted over the leg that you don't feel comfortable on adequately, then you're not going to be able to unload this leg. So by working on crossing across midline, you're also working on making sure that that center of gravity is centered over your foot. So just cross over and back. And again, we're working on cadence, so you do want to kind of go right into the next step. Doesn't have to be perfect. Get in a corner, get walls around you in case you lose your balance. Losing your balance is not necessarily a bad thing. If you lose your balance and you recover on your own without touching anything, you're actually strengthening your body's ability to resist a fall or to prevent a fall. So it doesn't have to look perfect. You just kind of have fun, play with it a little bit, and just work on building your confidence on immediately getting weight onto that leg. And then that's it as far as the exercises. But as I do in a lot of videos, you always want to take some of these exercises and kind of put them into practice. So whichever one or two of these exercises you choose through the exercises we went through in this video, follow it up with some walking. And remember, we're working on increasing that cadence, meaning number of steps per minute. A metronome, again, is a great tool to just kind of measure that cadence and kind of keep working on increasing it. So kind of set that cadence low. You could set it at like 60 beats per minute or even 50 beats per minute, and then just kind of build up from there. Remember, the goal is 80 to 120 steps per minute. So have fun, and hopefully this video will help you to improve your walking speed. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you will get notified every time I upload new videos. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.